My name is Michelle Q. I'm an orthopedic sports medicine and shoulder surgeon here at the Hospital for Special Surgery. So I see patients of all ages, from the young athlete injured in a sporting event to the weekend warrior who was out running in Central Park, all the way up to the patient who has shoulder arthritis or trouble reaching for things on the high shelf or trouble walking around their neighborhood to the grocery store. It really is the gamut of all patients who have shoulder, elbow, or knee injuries that come to see me in my office. So my approach to patient care is a partnership between myself and the patient. I approach it as a team. We have to listen to the patient. What are they bringing to the table? What symptoms are they bringing? What are the main complaints? Are they having trouble walking around? Are they having trouble getting back to athletics? What are their goals from the visit? Are they looking for a surgical discussion? Are they looking for more of a conservative care? And then I look at them and we do a physical exam together. We go over the imaging together. I think it's a very important part for the patient to understand what their diagnosis is, what the imaging findings are, and what that really shows them about their diagnosis and leading into what the treatment options are. So sports medicine to me is the medicine of treating people who are active. They don't have to play a sport. They don't have to be an elite athlete. It's just somebody who is active and is unable to do so because of a musculoskeletal condition. Determining the right course of treatment is very patient dependent. It depends on what they come to see you for and what their ultimate goals are. Or is the patient trying to get back to a sport? Is the patient trying to get back to just something simple like walking around their neighborhood without knee pain? It really is a discussion with the patient, their imaging, their physical exam findings, and ultimately it's a shared decision-making model. That's the ultimate goal. When a patient comes to see you in the office and they have a difficulty with their shoulder or their knee, and you're able to recommend either a conservative option such as physical therapy or an injection or even a surgical option, and they're able to come back from that and walk into your office without a limp or walk into your office and reach over their head, and the smile that they have is really all the things that you need. It really is the best feeling when a patient can tell you, I can do this now and I couldn't do this before and it has changed my life for the better. It really is the best feeling that you can have.